Good afternoon everyone. Today we are discussing about Ryles tube insertion procedure. Ryles tube, also known as nasogastric tube, is a thin flexible tube inserted through the nose into the stomach. It is used for feeding, medication, administration, gastric decompression or lavage. The insertion process involves lubricating the tube, inserting into one nostril and guiding it down into the stomach with the patient's assistance by taking sips of water and swallowing. Then we are discussing about the purposes of Ryles tube insertion, which are to provide nutrition and medication to patients, to aspirate gastric contents for diagnostic or therapeutic reasons, to perform gastric lavage in poisoning cases. Now we will see the articles, which include a kidney tray, a small bowl with cotton ball, stethoscope, then the Ryles tube. Mostly we take 16 or 18 size in French. Then the clean gloves to prevent the transfer of microorganisms and to maintain a clean environment during procedure. Then we have to take 10 or 20 or 50 ml syringe to check the placement and to give feeding to the patient. Then the adhesive tape, artery forceps and Macintosh. And at the end we have to take large bowl with water. So now we will start the procedure. First, explain procedure to the patient to obtain cooperation. Position the patient in a high Fowler's position, which is sitting upright at 60 to 90 degree. By giving this position, the Ryles tube gets help in getting inserted to reduce the risk of aspiration and improve breathing. So we have to take the Ryles tube and check it properly. Measure the length of the tube from the bridge of the nose to the earlobe to the xiphoid process and indicate this length with a piece of tape on the tube. Remember the abbreviation NEX, which stands for nose, earlobe and xiphoid process. Now as you can see, I have to measure the length of the Ryles tube for insertion. For that, take the end of the tube and place it at the tip of the patient's nose. Then extend it to the earlobe and further down to xiphoid process. Xiphoid process is the lower end of the breastbone. This measurement helps ensure that the tube reaches the stomach. Mark the tube at this point to guide the insertion depth to prevent complication and for early checking later, which means the mark acts as a reference point to see if the tube has moved or come out during use. After identifying the marking area, as you can see, I am putting tape on the marking area. After that, the Ryles tube is very soft, and because of being a soft tube, it does not get inserted properly. So, we have to take a bowl and put cold water in it and keep the tube in that bowl of water for some time. This will make the tube hard, due to which there will be quick and good tube insertion. As I told you, we have to keep the tube in cold water for some time. After that, we have to wash our hands thoroughly and wear gloves. Then we have washed our hands and worn gloves. After that, we have to take a pair of artery forceps and clean the nose area properly to minimize the risk of infection, to ensure proper tube placement, to reduce patient discomfort and prevent obstruction during the procedure. After that, whatever waste product is there, we have to properly discard it in the kidney tray so that the infection does not spread. After that, we have to take out the tube which we had kept in cold water to insert it in the nose. If we had inserted the tube like this, then there are more chances of injury. So, to prevent this injury, we have to use lubrication jelly. Here we are using lignocaine jelly. So, we have to take a little amount of lignocaine jelly on the hand and apply it on the tip of the tube. As you can see, you have to apply lubricant properly in the tube. After lubricating the tube, we have to insert the tube slowly into the nostrils. And we need to insert the tubing exactly up to the line we marked. When the tube nears the back of the throat, instruct the client to swallow or drink sips of water unless contraindicated. If resistance is made, slowly rotate and aim tube downwards and towards the closure ear. The most critical concern is misplacement into lungs instead of the stomach or esophagus. This can cause aspiration pneumonia, lung injury, or even be fatal. So that's why we have to keep the placement of the tube properly. After that, we have to check the placement of the tubing. So, in the first method, we have to take bowl filled with water, and then we have to insert the end point of the tubing into the bowl. After inserting the tube into the bowl, if bubbles appear, then it indicates that the tube is properly placed in the stomach. If bubbles do not appear, then it indicates that the tube is either in the trachea or the placement of the tube has not been properly. Then for the second method, we have to take a 10 ml syringe. In the second method, if we want to identify whether the placement of the tubing is correct or not, then for that we take a 10 ml syringe and attach it to the tubing. Then slowly push air inside the tubing, and at the same time we listen to the sound through the stethoscope. After that, we will take the stethoscope and place it on the xiphoid process. And as the air is pushed, we have to hear the sound. So a whoosh sound comes if the placement of the tubing is proper. After seeing the placement, we have to place the tubing properly and stick it because its place should not be changed. Then after care, we have to take care of two things. First, whatever documentation is there, we have to do it well, and secondly, we have to check for complication. So what complication can arise in Ryles tube insertion? They are ulceration, bleeding, misplacement and clogging of the tube. So this was our Ryles tube insertion procedure. If you have any problem related to this topic, then please let me know. Thank you.